Hope for Anxiety and OCD, Episode 3. Today on the show, I am interviewing Melanie Lowe, who is a nurse practitioner at Cornerstone Primary Healthcare in Hendersonville, Tennessee. I was really excited to be able to speak with a medical professional on the show to talk about some physical issues that may be causing or contributing to anxiety. A lot of people don't know that when you're experiencing anxiety, a first stop to the primary care physician to get some testing and blood work is really in order. Melanie and I are also going to talk about being a Christian and taking medication for mental health issues. So let's get to the show. So I am excited to have someone on the show today from the medical field. And so can you tell us a little bit about yourself and how you got involved in the medical field and kind of the decision, the process to start your own medical clinic?
Sure. My name is Melanie Lowe, and I graduated from Auburn University. That's where I did my undergraduate in 1994. So I practiced nursing in an open heart surgery center for 3 years and then decided to go back and get my master's in nursing, but that was in nursing education, because my ultimate goal was to teach in the nursing programs there in Auburn, which I did for 3 years. And that was a great experience because as a nurse, we just love to be educators as well. So after that period of time, we started a family, my husband and I. We have 2 children. And so I took 8 years off from school to raise the kids. And then once they got into school, then I said, okay, it's time for me to go back and get back into the nursing field, which I did. So I went to work. We moved from Indianapolis to Hendersonville, Tennessee, and I went to work for Vanderbilt in the cardiovascular unit there. And then I decided after 2 years that I was ready to go back and get my nurse practitioner degree, which I got in 2008. That's the progression as to I got to be a nurse practitioner. And that is my ultimate goal in love. And I just love it.
Okay. Maybe you can help some of our listeners because I know we hear different titles in different fields. What is the difference between being a doctor and being a nurse practitioner?
Sure. So doctors, of course, you'll have the different degrees. You'll have a primary care provider, internal med physician. They go through, of course, undergraduate medical school, and then some of them do different extended studies if they want to be an endocrinologist or a specialist, cardiology, and things of that nature. So they are in medical school. Then you have the mid-levels, which are nurse practitioners and physician's assistants. They do similar jobs. They work alongside of doctors a lot of times in various clinics, but nurse practitioners and PAs can also go out on their own, like I have, and open up their own medical clinic. In the state of Tennessee, we have to have a supervising physician. So you will see that there's sometimes when we write certain medications, narcotics, we have to have a supervising physician to sign off on that. And they have to be in our practice at least once a month, just to sign charts, not to actually see patients, but they need to be overseeing us at least once every 30 days. But mid-levels can prescribe just like physicians. They can, order imaging. They can make referrals. So when it comes to the medical care, we can all do the same thing. It's just that the nurse practitioners and PA have less schooling than physicians.
Okay. Do you feel like there are benefits at times to seeing a nurse practitioner over a doctor?
Well, as most people probably know generally, most nurse practitioners will spend more time with their patients. And I think that that's one of the big differentiating things between mid-levels and a provider that's a physician. What you'll find, though, is that in corporate clinics, there's a schedule. And of course, that dictates how much time you can spend with each patient. And so if you go out on your own and start your own clinic, then of course you can decide how much time you want to spend with each patient, depending on how in depth you want to go. And for us being a Christian-based clinic, we have the opportunity to talk about emotional, spiritual, physical, all of the aspects versus it just being like, you're in here to get your medications refilled and we're moving on to the next patient. So we have a lot of flexibility with our schedule and how long we want to spend with our patients. And that's one of the biggest things. The tagline actually for my clinic is the full extent of medical care with the heart of a nurse. And I think that kind of encompasses everything. So we can do the whole medical realm, but then with the heart of a nurse, lets them understand that we want to sit down and get to know their families and their children and things that's going on in their life. So that gives us a little portion of the heart of a nurse.
I think that's really huge because health is so interrelated. Our physical health and our emotional health and our spiritual health is very interrelated. And a lot of times, unfortunately, seeking help or treatment, we're only isolated on one aspect of those when really we need an all-encompassing approach.
Right. And that's why when the vision came with my husband and I, when we decided in 2010 to start a clinic, we didn't know what that clinic was exactly going to look like, but we did know that we wanted to be a Christ-centered healthcare. And therefore, that's the name Cornerstone. That's how because we wanted Christ to be the cornerstone of the practice. And the biggest thing for us was to do the physical, emotional, and spiritual health with that. And because that makes up each individual. And you're right, if you take out one portion of that, then usually if you're great physically, then maybe emotionally or spiritually, you're not doing so well. And that affects us physically. Each one of those is so interrelated. And I think that's one of the biggest reasons that patients, when they see a Christ-centered or Christian-centered clinic, they're more apt to come in, feel open to share their faith, discuss what's bothering them or maybe a struggle that they're having. So that's where we have found our biggest benefit, we think, to most patients. And we have lots of stuff around, like we have lots of artwork that's Christian. We have scriptures that are up on the walls. And I think one of the biggest things for us is we have a prayer board out on the wall. So that allows the patients, when they come out, we have little cards that say prayers or blessings. And so if they have a prayer request, we don't put anything identifying who they are, but we put those on there and we put them on our wall. And then as they come in and we hear that, wow, their health issue has been resolved, or they got to buy the house that they didn't think they were going to get, then we move it over to the blessing side so that they can actually, people can see how we've transitioned and how prayers are being answered. And the other part too, and other people are coming in because they just want to sit down and have you pray with them because they've gotten some medical, like maybe they have cancer, they've got some kind of diagnosis, and they will literally stop in and just ask if they can go to a room and pray. They're not here for an appointment. And so it kind of gives you that welcoming and inviting part. And you're right. That's how this is all together, physically, emotionally, and spiritually.
That's a very unique practice concept. I don't think that I've ever heard of anybody that's practicing medically in that way. So that's pretty unique.
Yeah, we have found that it's a lot more accepting, I think, than most people would, I think, initially feel that it would be. We have believers that come in who are Christian. We have people of other faiths. We have non-believers. But if they're struggling with something and you ask if you can pray with them, I have yet in 10 years had anybody tell me that they didn't want me to pray with them. Amazingly, they're very accepting of that. We don't push it on them, but we just say, hey, is that something that you would allow us to do with you? And they're very open, and it's our ministry. This is kind of a ministry. Each person has a ministry field, and this is what it is for me. So I can actually have my ministry field and my work all in one.
Right.
Yeah, so it's helpful.
Yes. So one of the things that I see in my practice, I will always ask people when they initially come in, do you have a primary care physician? And unfortunately, we're living in this day and age where many younger people don't really see the value in primary care. They don't see the value in going to the doctor for just a general wellness checkup. And so they'll tell me things like, well, if I get sick, I just go to that little place in the drugstore or something and they take care of it. Why do you feel like it's important for people to have a primary care physician that they go to?
Sure. And that's a great question. We have a lot of people that do the same thing, especially the younger people who maybe don't have any chronic illnesses like you're talking about. We're thankful that the urgent cares are open on the weekends and after hours. But what we would hope is that someone would call their healthcare home. We want to be the home of the person so that, they can go somewhere else if we're not available. But ultimately, the importance of a primary care would be you begin to build a relationship with that other patient. And then if there's changes that come along the way, whether it's maybe something that you see in them, something physically you see, or in labs, you can watch trends and you can start seeing those changes. But that's over time. That's not something that you would normally know if you went in to get a sinus infection. And then the next time you had a urinary tract infection. Well, nobody's really keeping up with all of the other aspects of your life. So that relationship would be one of the biggest things. And then the second thing would be trust. If you go to see somebody on a regular basis, you build that trust with them, and then they're more apt to open up and tell you maybe some internal struggles that they're having, or, hey, this is kind of embarrassing. I don't really want to tell you about it. But then they will feel that they trust you enough and know that it's in confidence that they will tell you things that they won't get a chance to tell somebody that's at an urgent care. And then something that you brought up was screenings. We see a lot of people who don't get their once a year annual screening. And those screenings are so important because you can catch things really early. And so that you can take care of them and treat them before they become a more serious and more difficult to treat problem. And so screenings are super important, whether it's wellness exams for just your overall annual physical, whether it's PAPs, whether it's mammograms. We try to do all of the screenings to keep people up to date on those. And so if you're going and you're not having that continuity of care, nobody's keeping up to when your last mammogram was or when your last physical. And so it's super important to have that relationship so that that can be developed along the way. And then there's ultimately better outcomes for the patient when you do that.
Right. That absolutely makes sense to me, that someone that can see your whole health history across time and start to notice patterns maybe before you do or before a one-stop shop would.
Yes, exactly. Exactly.
Yeah. So sometimes people come in and they may feel intense physical symptoms and you may rule out medical causes and it looks like it's anxiety. Can you talk with me like a little bit about that process? How do you know or differentiate, is this person who's maybe presenting with difficulty breathing or rapid heart rate? How do you know if that's anxiety or not?
Yes, so most people who struggle with anxiety know that some of the common symptoms would be things like a headache, a rapid heart rate, like you mentioned, palpitations where they may feel a skipped beat or two, difficulty sleeping, their mind is racing. They might have a lot of GI issues, stomach, diarrhea. So amazingly, that anxiety can cause symptoms in multiple body systems. And so our thing to rule out, a lot of it can be done through blood work, EKGs, things of that nature. So some of the underlying causes of what you have to figure out is which is the anxiety causing the physical symptoms or is something physically making them have anxious feelings. And so for us, if you rule out deficiencies such as like vitamins, so say B12 and B6 and iron, those deficiencies can cause people to have anxious feelings if they have a hormone imbalance. And that hormone could be thyroid. So hyperthyroidism, where your thyroid is in your neck and it controls a lot of different parts of your body, but one of those is how rapid your heart can go. So if you have hyperthyroidism, you are in overdrive. And so you have a lot of thyroid, which increases your heart rate. So, and it can feel very anxious. So if somebody comes in and they're having those symptoms and you do a simple blood test, you can find out if that's the cause, you treat their hyperthyroidism, and then their anxious feelings all go away. Anemia is another one. If someone is either losing blood or maybe not making enough blood, so their red blood cell counts are low, the same thing. They'll have a rapid heart rate. They're short of breath, which those are very similar to what people experience with anxiety. So if you rule that out as a cause and find out why are you anemic, give them some iron, build their stores back up amazingly, you can get rid of some of those symptoms. Some people actually have underlying heart issues where their heart will race or they'll have skipped beats. And that can be from electrolyte imbalances like magnesium and sodium and potassium, or it could be an underlying heart issue. And again, once you take care of that, it'll help with the anxiousness. A lot of people drink too much caffeine. They'll have caffeine in the morning and then they'll have some monster drinks. And so all of those, so that caffeine or any other drug abuse that they might have, if people have drug or alcohol abuse, those can all cause, or actually withdrawal, even from drugs can cause similar symptoms. And you need to get that, again, that trust and building that relationship with the patient will let you ask questions. Do you struggle with, taking too much pain medication? Do you struggle with some of these things where, obviously you wouldn't have that opportunity in an urgent care? Sleep deprivation, if somebody has sleep apnea, for instance, and they don't even know it, and they're not sleeping well at all, then over time, when they're sleep deprived, anxious feelings, inability to think clearly, all of those occur. So simple things can rule out the physical, and then you can determine if the anxiety is really the underlying cause or if it's something else.
I'm glad that you brought up sleep and sleep apnea, because I know I have had several clients that went through the sleep study process, found out they had sleep apnea, and as they started to wear the mask at night and get that treatment, that their mental health has improved dramatically. Not to say that all of their anxiety or depression has gone away, but they feel so much better physically, which helps them feel better emotionally. And a lot of times that goes undiagnosed for a while, right?
It does. And not everybody falls into the typical category of what you would expect somebody with sleep apnea to have. A lot of times they always say if your neck is greater than 17 inches, like if a man's dress shirt, then if it's above that, then you might be apt to have sleep apnea. A lot of people wake up and they are just as sleepy when they wake up in the morning as they were before they went to bed. And so that can give some people some ideas. And then those who have partners or are married, they're the ones who can say, I witnessed them stop breathing and they're having issues. But sleep deprivation and sleep apnea can lead to things like those, when we talked about other hormones that can be lower, testosterone specifically, and estrogen. So if somebody has sleep apnea, then of course, and they have the symptoms of a low testosterone, of course, they can feel anxiety, depression, things of that nature. If you take care of their sleep apnea, amazingly, just like you said, a lot of other things fall into normal, and then they can rule out what's left as the cause. Mm-hmm.
I'm curious about what you think about this issue related to sleep. Is that we also are living in a society where people seem to think that sleep is optional. Like I can just kind of sleep 6 hours a night and then, down an energy drink in the morning and then have maybe a cup of coffee in the afternoon and I'm good to go. Everything's fine. But what are we really missing out on medically and physically when we're missing sleep?
Right. When you have very short spurts of sleep, or you're using things such as caffeine to keep you awake, and then some people will use alcohol to get them to sleep, those things start to mess with your circadian rhythm, and then your sleep cycle gets off completely. And so what happens with that is when people are using, like I said, caffeine or other things, once that sleep cycle gets off, you have to go through a withdrawal period of those in order to get things to cycle back into normal. And then you'll see some people who need, like you said, some people may need 5 or 6 hours of sleep. Other people do not function well without 7 or 8, if not more. And so when they wake up in the morning and they can't think clearly, and I'm sure we've all done this at some point, we've gone through where we haven't slept well, and you feel like you can't even recall a name. You're like, I can't recall a word. You can't think of what you did yesterday. And all of that are symptoms of we haven't had enough sleep in a long time. So it's really important. And that's the time where your body has a chance to restore itself, heal up, and reprocess and put memories in place. I mean, it is amazing what your brain does during that time of sleep, and it needs to have it adequately each night for you to feel that way.
There's definitely a connection between trauma and sleep disruption, and that inability of the brain to process that information at night can really cause more problems during the day, is something that I've seen from the mental health side.
Sure.
So do you see quite a few patients in your practice that present with anxiety? Is that something that you see on a regular basis?
Yeah, we see it every day. And I think one thing that surprises people is that probably 60 to 70%, and I know that sounds like a large number, of patients that see us on a daily basis are coming in with some type of anxiety, depression, combination of that. It is just amazing how many people and how prevalent it is for even our young people. I think there's a lot of pressure for young people to get into colleges. I mean, I think it's starting out a lot younger now. I treat 12 and above, so I don't see a lot of really young patients. But in the adolescents, they're all competing to get into a certain college, and they're trying to study for their certain tests, and there's so much competition. And that, I think, is part of it that starts it. So we see that starting in young people. And then we have everything from, it could just be life circumstances. It could be that during this COVID, we have noticed a remarkable number of people who are having the mental health aspect of it now, not as much physical. Like I said, we have not treated anybody so far with COVID, but during this pandemic right now, we are seeing it escalate. So people who have never been on medications before are starting them, or those who are already on something, we're having to increase it just to help them cope through this. But it is more prevalent. And I think now it's exciting that the stigma is not there anymore. So we openly talk about mental health issues with patients every day, because it's not that stereotype where we feel like we can't tell anybody what's going on. So we do try to make that something that we bring up in conversation. Do you struggle with anxiety? Do you struggle with depression? And so that way it opens the doors for people to discuss that with us. But it's a daily thing for us.
I think that's a great thing, because a lot of times the medical professionals can be a gatekeeper to people seeking out counseling or mental health treatment, like you said, because they do have a relationship with you, but maybe they're concerned about going to a counselor, and you can talk with them about, hey, this is something that could really benefit you, and work alongside the medication that you're taking to help you see even more improvements.
Right. And I think with us as well now, a lot of people they either get shamed into not taking medication, they get from friends or family, or even within themselves, they feel nervous about taking medications because they've been told you need to pray harder, your faith is not strong enough. And, I think that's very difficult for the patients when they come in here, because they already are dealing with that guilt of having to come and ask for help. And we try to make it as easy as possible and just present all of the options that they have and then let them choose what's best. Because just that decision to go on medication or to get counseling, admit that I have an issue with anxiety, that is a huge thing for people. But once they make that and commit to it, it's amazing how much benefit they get from all of these, whether it's medication, counseling, it doesn't matter. I mean, there's a huge benefit with all of those together. And some people are open to moving past that and getting that help, which is what we love to see. We love to help them.
Right. What would you say, because this is a argument I hear a lot, people will say, I'm concerned about getting on medication because I don't want to become addicted or dependent on something. I don't want to have to be on this medication for the rest of my life. What do you say to someone with that type of argument?
Sure. And that's one of the things that we discuss with patients when we do start those medications, because what we found is when patients start them, it doesn't necessarily have to be a lifelong. We tell them, it all depends. It could be their life experiences. They could genetically be predisposed to have some of these mental health issues because of family genetics, life experiences. And so they may need to be on something long-term. They may have realized that I've been struggling with this since I went to kindergarten. And so those people are probably looking a little more long-term, but the majority of the people that we start on, it may just be situational. It may just be, I have just lost a loved one. I recently was divorced. And so they'll take them 6 months, a year, and try to see how, through counseling and through journaling and all the lifestyle modifications, how they are doing after 6 months or a year, and then come off of them. And I think the other thing too is a lot of people still have that thought of that the medications are going to somehow change their personality. It's going to make them they're going to withdraw from people, or people are going to know that they're on something. But amazingly, the medications are so mild that they just take away the symptoms in people's personality. It actually gets rid of all the cloudiness and things, or the things that maybe was suppressing their personality. It actually removes all that. And now the people go, that's the old so-and-so that I knew before. And they start to see those personality traits that they had, but they haven't seen those in a long time. So it's not a lifelong necessarily. And some people need to spend 2 or 3 years, but a lot of times we can just use them to help them transition through some circumstances and then come off the medication.
I actually did that in my own life. When I went through a divorce, I got on an antidepressant for 6 months, and I was in counseling during that period as well. And I followed up and talked with my counselor about coming off the medication, and I talked with my doctor about coming off the medication, and they were both in agreement that it was time and that I was feeling more hopeful and better and functioning better in my life. And so that was a huge help for me for those 6 months to have that, because it made it so that I could continue to work and could continue to function and be a responsible adult.
It is amazing how like you said, there's so many different types of medications now that we aren't just stuck with a certain class. And so we as primary care, most primary care providers will start somebody on something and take care of them. And then if it ever escalates and needs further combinations of medications that we in primary care are not as comfortable in prescribing, that's when we'll send them to a psychiatrist or someone else who can put together medications that we do not feel comfortable putting together. But the majority of the people we can treat in primary care, just like with any other disease process. And Carrie, that's one other thing is I would say a lot of people feel that mental health medications aren't as important. And I think that's why they try to tell people not to get started on them, because you think about diabetes. That's a chemical imbalance. Think about hyperthyroidism or hypothyroidism. It's a hormone issue, chemical imbalance. And we would not look at those people and go, just keep praying. Now I'm telling people that pray. We wouldn't tell them and shame them into not getting help. We would never tell them that, hey, if you pray hard enough, your blood sugar is going to go down from 500 to 200. We would treat them. And I think we need to understand that, and most people are on board with this, is they use this as another chemical imbalance. And that's why I feel like the stigma is gone, and we just need to talk about this openly, because so many people struggle with it, and there's options. It would be different if we had nothing to offer, but there's too many things that we can do to help them.
Right. I agree. And I like that you brought up that there are different classes and different types of medication that people can be on, because they may start on a particular medication and it just doesn't work as well for them. People's body chemistries are a little bit different, and they may have to try a different medication or increase or adjust the dosage in some way in order to feel better.
That's exactly right. And a lot of the times we get that information from counselors. Like maybe a patient goes to see a counselor first, and they're the ones that say, you know what, I think that this person would really do well with starting a medication. And that's, I think, confirmation to the patient as well. that they have two different people, like you said, you got your counselor and then you're with primary care. And now together, you're going to see them in your office and you can kind of tell if you can think clearly and you can see some improvement and benefits from the medication. Or you can also, we can see from our end going, okay, no, you've had a lot of weight gain. It looks like you are still really struggling and you're crying a lot. And so together as a team, and this is again, one of those team approaches where we just all need to work together. If there's a side effect, speak about it, tell us, like you say, because there's a lot of options and we can just change it up and make it where it's best for both.
Right. Awesome. Yeah. Let's talk a little bit about how lifestyle changes can impact us in a positive way, our physical health and our mental health.
That's a great one because a lot of times, people may not have given as much thought to maybe their diet and exercise. I know we ask them about that a lot, but a lot of people don't realize how that can actually impact mental health as much. If you think about diet, when they used to say, what goes in is what comes out. But to be honest with you, there's so many foods and so many different diet plans and stuff that people are on. Not all of them are best when it comes to nutrition. So I would say, definitely read through and find out which diet plan is best for you, whether it's just losing weight or is it just eating more healthy anti-inflammatory foods, meaning things like reducing your gluten, reducing your dairy, and reducing your sugar. That is probably the three biggest things. And those are the best tasting things usually. So
that's how it works.
It is. That's hard to get people to realize that. But if you just reduce those gluten, sugar, and dairy in your diet, amazingly, people feel more energetic. Their joint aches and pain, everything that could be inflamed, it amazingly helps that. And so that is one huge dietary thing, if I could impress on anybody, is to try to use that kind of diet. Don't go strictly keto and don't go strictly whatever. But I'm just saying, just do a balanced diet with a reduction in those three things. And I think people would feel better overall. Along with that is exercising. It's hard. People are struggling with time. They can't find enough time between family and work and other outside responsibilities, taking kids to their different activities. And I think part of that would be find 15 or 30 minutes. It doesn't take a lot. You can actually find videos that do 10 minutes of high impact in the morning or in the evening. And so I think each one of us, if we looked hard, could find 10, 15, 30 minutes a day. But the goal is somewhere around 150 minutes a week. So if you can pick out 45 minutes, 3 to 4 days a week, or just 30 minutes, 5 days a week, and find out what you love, just get up and move. It doesn't matter. Just do something. Gardening, mowing the grass, as long as it's not a riding lawnmower, right? That sort of stuff, walking the track. And then along with this as well is getting out there and having a support, like get out with your friends, do something that you enjoy and get that accountability, because it's so much easier to do this stuff with other people. Plus you can talk to them and solve all your problems while you're walking and you're doing your healthy stuff as well. But those are just some of the things that, in addition to medications and counseling and things, that would be helpful for mental health.
Absolutely. Before the pandemic started, I was very involved in group fitness, and that was just a lot of fun to get together with some other ladies and do a dance workout or, a boxing workout. And it's just fun and it's helpful. It keeps you going to have somebody else there with you exercising, right. I think keeps you committed to it. I know that there have been studies done where they've actually compared people who were on antidepressants and people who exercised and people who did both. And a lot of times the people that fared the best did both, but the people right. that, had the exercise, sometimes they did as well as the people that were on antidepressants. So that's pretty incredible to have that type of results.
Yeah.
Yeah, very good. So kind of like as we're getting to the end, I think this has been very helpful information that you've shared with us. I like to ask every guest to share like a story of hope, which is maybe a time that you received hope from God or another person.
Yeah, mine probably doesn't come from a specific person. I would just say that, God has given each one of us certain gifts and talents that we're supposed to use to bring others to Him and to further His kingdom and to glorify Him. And I think if we find something that we're passionate about and that we love and we keep God first and focused, like in the perspective of putting Him as a priority, that He will be steadfast and He will be the one that gets us through and makes us feel fulfilled. And I think that like back in 2010, just opening up this clinic, it was stepping out on a limb and it was stepping out on faith. And there were times where you're like, there's not a single patient. Like when we first opened, there may be one patient in an 8-hour day. There could be two, or people, there's times when there's financial difficulties going, are we going to stay open or are we just going to sell out to a corporate or just close down? So there's lots of things along the way, but continuously God would put people in place, or the patient would come in and it's like, let me pray for you. And it was amazing how it became almost like a community. And so it was over and over. God was just like, just be steadfast, continue on this path, even though you can't see what's going on, and then rely on me. And so doing that over and over, now during this pandemic, here we are, moved out of our old place where we rented, we built a building. And during this COVID, when everybody else is, furloughing people, we're hiring and growing. And the Lord's just like, just be patient, just continue and be patient. And I think that would be just a sign of hope for anybody that's trying to think of maybe something that they're passionate about, but they're afraid to maybe step out. But I would say just step out in faith and just continue to pray about it. And if it feels like it's not going to work out, just continue to be in prayer and have others pray for you. And amazingly, it'll work out, or you'll find out what you need to do next.
Right. God has a way definitely of coming through right when we need him. And that's awesome. It's really an encouraging testimony. I appreciate you sharing all of this helpful information and taking your time to be on the show. I hope that this podcast really encourages people that if they don't have a positive relationship with a primary care provider, that they can have that, and that they can find somebody that they can connect with and trust and have as their health home.
Yes. Yeah, thank you so much. And like I said, I agree with you. I just want people to reach out and ask for help and not go through this alone.
Right. Absolutely. Absolutely. I enjoyed this interview, and I hope you found the information helpful. When we look at a symptom that our body is experiencing, such as anxiety, it's important to evaluate what is the message. Like, if this is the symptom we're experiencing, what is the meaning to it? And so sometimes this may mean that we're having physical issues such as a malfunctioning thyroid, or it could mean that our body is responding in response to past trauma that we haven't processed. Or anxiety could be the result of constantly living in the future and worrying instead of learning and focusing on being in the moment of what's actually here right now. Anxiety being such a broad symptom, I just really encourage you to look at what is that symptom, or what is your body in a way trying to communicate to you. And you may need some medical help or some counseling help to help you figure some of that out and tease it out. And that's okay too. There should be absolutely no shame in getting what you need. It doesn't matter if that need is physical or emotional. I hope that this episode prompts you maybe to think about how you can take better care of yourself too. Until we meet again, you can find us on Facebook and Instagram, or always at hopeforanxietyandocd.com. Hope for Anxiety and OCD is a production of By the Well Counseling in Smyrna, Tennessee. Our original music is by Brandon Mangrum, and audio editing was completed by Benjamin Bynum. Until next time, may you be comforted by God's great love for you.